Doc on the Run. We help injured runners run.
The next thing to think about is why doctors misdiagnose you when you have extensor tenosynovitis, because this happens a lot. So the most common thing is that doctors misdiagnose you with something like a stress fracture, because stress fractures, the bones are right under the extensor tendons. So the extensor tendons run right across the metatarsal bones in the foot. They're very close together, and so sometimes when the doctor just hears your story and you've been ramping up, and then it was really that your shoelaces were too loose or too tight or something like that, or you were doing hill repeats, but they hear that you've been fine, you've been running for a long time, and then, without adding tons of mileage or something, you just had one day when it started to ache and started to hurt, and then it got progressively worse. And that sounds a lot like a stress fracture. Stress fractures are more common than extensor tenosynovitis, so the doctor assumes that's what it is, and maybe they don't even look at your foot, which would be more likely that they'd make a misdiagnosis, but maybe they do look at your foot. Maybe they look at your foot, they're in a hurry, but they kind of poke around and they push on what they think is your fourth metatarsal, but they're actually pushing on the soft tissue, because the soft tissue is, underneath the skin and over the bone. So when they push on the skin and push down on the bone on your fourth metatarsal, and you have pain, they say, okay, well, there you go. You have pain on that metatarsal. Your story sounds like a stress fracture. It looks like a stress fracture. You have a stress fracture. But you don't. You actually have extensor tenosynovitis because they pushed on the extensor tendon at the same time. So they need to be careful and diligent about which structure they're pushing on, how they're doing it, how they're stressing it, and do some little tricks to basically stress that particular structure individually to make the right diagnosis. Because if you get a doctor who tells you have a stress fracture of the fourth metatarsal, you probably don't want to run 100 miles on that, because you could break it. You could try, but if you break it, that's not a good thing. So if you have extensor tenosynovitis, though, and you run on it, it may hurt, but it's not going to kill you. It's not going to break. So it's not as big a deal. But it's really important to figure out whether or not you might have been misdiagnosed. If you have, then you have to do something about it.
Doc on the Run. We help injured runners run.